Hello, everyone. So I know it's been a while, but welcome back. So I'm just gonna give you guys a kind of brief update of what's been going on recently, and then I'll kind of be explaining today's topic. So maternity care providers. That's gonna be something that I wanted to talk to you guys about, so you guys just have a little bit more of an understanding of what a maternity care provider did. Also, just a quick update what's going on with MEM. So basically, they just announced today that we're going to have 2 courses that are in person if we would like, if we're opting into that. So definitely that's something I'm going to be looking into. I think it's Intro to Midwifery and Critical Appraisals of Midwifery. So definitely those are going to be 2 interesting courses that I think will be really beneficial to definitely get that in-person skills with. And I'm really excited to kind of meet with my fellow classmates. We also made a group chat not too long after finding that we got accepted. So it's really been nice to kind of communicate with different student midwives and really kind of saying like, hey, what's this and what's that, and really getting engaged. So I'm really excited to meet them and as well as keeping in contact with them. In June, we had a basically kind of like a brief orientation, just kind of being what's going on about transfer credits and whatnot. So if we want to transfer over any credits, we were able to do that. And then in August, I think August 11th and 12th, we're having basically 2 days worth of orientation where we're going to be basically discussing what the program's going to be looking like in September. And then August 10th, I believe it's orientation and not orientation, course selection. So I'm definitely at 6 a.m. So that's going to be fun to wake up and pick my courses. But I believe for full-time students, we don't really get an option. I believe just really definitely kind of picking the my electives. A little bit about me, what's going on. I've definitely been really kind of networking, working with different student midwives, kind of talking with them, kind of getting some information, and really opening my eyes to midwifery. So definitely, like example, being available and kind of being on call per se. So definitely trying to say like, okay, how long does it take me to get ready? I know I have like maybe like a year and a half until placement, but still like I want to start to be able to kind of okay, always being ready, never being a little bit never being too hungry, never being too tired, kind of reacting when my phone pings. So I'm like, okay, like everything I want to try to live through midwifery right now. I also been kind of debating on kind of changing career paths. Not in midwifery, but example, like my day-to-day job right now. So recently I've been applying to a couple hospitals to try to hopefully get a position. I recently just kind of did like a meet and greet with Scarborough Health Network with one of the managers of the Women and Children's Health program. So I'm really definitely hoping, fingers crossed, please guys keep your fingers crossed that I get it, because that will be something definitely I want to really open my eyes to and kind of also get that that hospital point of view, and also just getting myself back submerged into the medical community. It's been a while since I worked at a clinic, so definitely it'll be kind of really reassuring to just kind of get back into the program and back into the field. So definitely it's something I'm hoping to look forward to. So there's essentially 3 maternity care providers that are available for you when you're ready to have a baby. So one of the few maternity care providers is a family doctor. So your family doctor is someone you're already kind of familiar with. They kind of do all your regular appointments and kind of making sure that you're healthy and whatnot. So not all family doctors, but a few end up following you throughout your pregnancy. They would follow you throughout your pregnancy, do all your postpartum care and your labor and birth. And sometimes when any other health issues arise, they just kind of take care of that and just kind of direct you towards like an OB or another physician that may be able to help you out. So definitely reach out to your family doctor if that's something you're kind of looking for. And then they usually sometimes team up with a nurse practitioner to just kind of help out with the pregnancy and the postpartum care as well. And it's sometimes it is a little bit more convenient to work, stay with your family doctor, definitely because you already have that relationship with them. But also for the postpartum care, that you're just kind of when an OB or a midwife would refer you back to your family doctor, you are already with your family doctor, so it's just a continuous continuous care. Like for example, for me, my family doctor knew me since I was since I was a baby. He ended up just retiring a couple days ago, but he knew me for 20 years. He didn't do my my pregnancy care and my maternity care, but he did my postpartum care. So as soon as I was delivered, they referred me right back to my family doctor. So he was right there from like essentially day 5. Another person that is able to help you during your pregnancy is an OBGYN, so an obstetrician gynecologist. They're trained in obviously the female reproductive health, and it's available for before conception, so preconception, pregnancy, labor and birth, and postpartum care. They're usually called in definitely for more of a high-risk pregnancy, which was like high blood pressure, or that you might be on different types of medication that might be causing your pregnancy to become high risk, so like heart disease, or if you're having triplets, we call triplets, like a multiple pregnancy, definitely that might be causing you to be a little bit more high risk. So definitely we usually have an OB involved, or recommend you to have an OB involved. And they're also there for normal vaginal deliveries. But once again, with an OB, they're very, very busy. They perform C-sections, they do all the surgeries, they could write they could write prescriptions. So they're very, very busy. So usually with a OBGYN, they would do your clinic. They have protected off-call clinic time, and usually they're on call one day a week. So usually the chance of having your OB deliver your baby is very, very slim. So you just have to, fingers crossed, that you deliver on the day that your OB is on call. Sometimes they might go back on call just for you, according to how your relationship is with your OB. But usually it's one day a week. They're on call at their hospital they have privileges at, so they're not able to deliver at any hospital, and that's any care provider. They have to have privileges at a certain hospital. So example, if you are looking at if you're really particular about wanting to have a certain hospital for your delivery of choice, definitely you're gonna have to look at obstetricians or midwives in that area. And last but not least, and I could already talk about these guys all day, is midwives. So midwives are registered through the College of Midwives of Ontario. They're able to do physical exams, order tests, screenings, and they're more available for low-risk pregnancies. And there's actually a study that shows that midwives, a person in care with a midwife, is more unlikely to have a C-section, which is kind of really, really cool to think about it. Like, you have not more of a risk, but there's a study showing that we have a less of a C-section rate. Midwives are there for low-risk pregnancies, and they're there for pregnancy, labor and birth, and postpartum care. A lot of times with midwives, you're able to kind of build that relationship with them, and they're following you to the birth. So a lot of times it's a really, you build a really good relationship with your midwife. So then you're feeling really comfortable, and they talk to you about pain management. They spend a little bit more time with you. For example, with an OB, they might spend a little bit, like maybe around 15 minutes with you, while a regular visit with a midwife is usually half an hour. So they can get really comfortable and build a relationship with you, and it really lets you answer any questions. With midwives, they have privileges at usually certain hospitals. They're able to deliver at birth centers, and they see you at home as well. So, or if you decide to have a baby at home. So, example, a midwife will see you at clinic. They will see you at home, and then if you decide to opt to have a hospital birth. Example, my clinic used to have privileges at 4 hospitals, so they would give you 4 hospitals of choice, and then you have your home as well to kind of opt to have your baby there. So a lot of times with midwives, they are your support person. They are the person that you turn to. So definitely that's something to look forward to and use. I know sometimes with people, when they have an OBGYN or a family doctor, they want a doula. So essentially a doula is a person who's trained in childbirth and like for emotional and physical and educational support, and they're acting like a support person, so who's kind of really for example, again, they will kind of meet with you during your pregnancy, see what you want to do for your labor and birth, and really kind of make it a safe, memorable birth experience for you. So a lot of times with midwives, they're able to do that for you. But example, I would really lean to having a doula if I was with an OB/GYN or a family doctor. So again, it's another support person who's a little bit more familiar with me and my body in how I would like to move on with how I would like the birth to go, and kind of give me some emotional pointers as well as physical support during birth. So really many different point of views and really different aspects of what a maternity care provider does and which one really feels more comfortable with you. A lot of times when I used to speak with clients, a lot of people really love their OB, and they ended up staying with their OB because they built that relationship with their OB, and they kind of like that 15 minutes appointments. They didn't really want to get into detail. It's just, okay, I'm having a baby, pretty standard. So they were like, okay, 15 minutes, whoever delivers the baby, delivers the baby. So they wanted more of a kind of a less of a hands-on approach. A lot of people who stay with their family doctor is usually very happy. It's kind of like continuous saying like, yep, all my kids were delivered by my family doctor, and they build that relationship with their family doctor, so obviously they feel comfortable with their family doctor, and it's kind of something they kept in the family. And I know people who would say, yep, I had 5 of my babies with midwives, and they said it was one of the best experiences, definitely because they have that emotional support of a midwife, but also how flexible a midwife is. They're on call 7 days a week, 24 hours, and yeah, and they're go-getters. They're available for you. You can page them at any time you want, and again, they give you that informed choices, choice of birthplace, and they really just want to make sure that you are doing the best that you can during your pregnancy and really advocating for you. So definitely, those are some things to choose when you're looking to have a baby. And I just wanted to top off and just kind of adding on to midwives. One thing that people are not really familiar with is that midwives are covered by OHIP. So you don't have to pay for having a midwife, while you do have to pay for having a doula. And with midwives, there's 3 main fundamental principles that we follow. As I mentioned before, informed choices and choice of birthplace. So choice of birthplace is definitely giving you the right to choose where you're comfortable having a baby. So you're able to have a baby at a birth center, at home, or in the hospital, sometimes in the car, on the side of the road, but definitely giving you that choice where you want to have baby and make that experience for you. Informed choices is basically a collaborative information exchange between the midwife and the client, and just kind of making that decision, the client making the decision, the client having that right to saying, you know what, no, I don't feel comfortable with this, and saying, you know what, that's fine, and giving you all the information why you maybe should do it, but also respecting your decision of saying no or saying yes. And continuity of care. Midwives are really big advocates for saying, you know what, I followed you throughout your whole pregnancy, and I'm going to see you to the end. So usually that's why you might have 2 or 3 midwives or a team of midwives assigned to you, so you're comfortable with them. You build that relationship with them, so that by the end you've built that relationship with maybe 1 or 3 or 8 midwives, and at least one of them will be seeing you at your birth, and then again with postpartum. So these are again some things that to consider when you're having a baby and seeing who best fits you. So definitely having these conversations, and I always tell clients when they're coming in, view your options. Like, don't feel chained down to just picking. Again, having that informed choices. Go meet with an OB, go meet with your family doctor, go meet with a midwife, and definitely having that conversation and saying, you know what, I feel like this is the best decision for me, and this is how I want my pregnancy to go. This is how I want my birth to go. Because again, this is something that's going to be changing your life forever. You're going to be coming, walking onto this as a parent. You definitely want to make sure, like, saying, like, you know what, this is what I want to do, and this is how I need help, and this is what I need the support, right? So definitely looking into those resources can definitely have a better impact. A lot of times, sometimes I'll be speaking with women and they're like, whoa, midwives are for free? I'm like, well, yes, free. It's covered by taxpayer dollars, but definitely they're like, if I knew that, I would have definitely opted to having a midwife and knowing that they would come see me at home after baby's born, and having them being on call for me. I really wanted that with my first baby, so I'm happy that I know this. So when I'm having my second baby, I'm involved. I have that support. So definitely research and get to know your maternity care providers. Get to know who does what. Definitely do your research, and it will really make a difference for you and your baby in the long run. Anyways, guys, that's all for me today. Definitely like, comment, subscribe, and comment what you guys want the next video topic to be. And let's do it. Let's have this fun. Definitely you guys are going to hear from me soon. School is going to be coming up really soon. So definitely I'm going to be kind of doing a bit more videos about like each course, what it's like. Doing weekly vlogs, just kind of giving you guys a heads up and keeping you guys to tab. So definitely comment below what you guys are wanting to see. And yeah, I should be seeing you guys shortly. Have a good day.